public health warning for anyone who's travelling to or from India. Officials there have sounded the alarm over a fresh outbreak of the Nipah virus on the southern state of Kerala after several suspected cases and at least one death have been reported this week. If you don't know what Nipah is, it's a rare but highly deadly virus with a fatality rate that can reach up to 75%, and it spreads through infected animals, often fruit bats or other animals, and can also pass from human to human, particularly in healthcare settings where we know that, viruses just absolutely have a field day, don't they, in hospitals. Here in the UAE, health authorities have advised increased awareness and caution, especially for residents travelling to high-risk areas. But what exactly is Nipah? How quickly does it spread and how worried should we in the UAE be about this? Joined in the studio today by Dr. Maryam Mojtabavi. She's an infectious disease specialist at NMC Royal Hospital in Sharjah. Thank you so much for joining me.
Well, dear Katie, thank you. And thank you for having me today. Yeah.
Well, we're delighted. You braved the Sharjah traffic, which I think you deserve a medal, don't you, for that. Returning to this Nipah virus infection, what should we be most concerned about here? What are the symptoms if, to say, you were to contract it?
So let's start with that. This virus, this Nipah virus, is not something new happened to us. It's a virus that has been known for years in part of Southeast and South Asia, and it is locating there. So these days it become a concern because of some cases reported recently in West Bengal, India. And, the virus is at the earliest stages look like other viral infections. It starts with fever, fatigue, malaise, body pains. But the most important thing with this virus is that it can easily progress to have very deadly or severe symptoms, something that might involve nervous system or respiratory system and cause, unfortunately, fatalities and some morbidities. But the most important thing is that it doesn't suppose to all people infected with this virus go for these fatal outcomes. And it is not that much spreadable. It's not that much widespread around the world because it depends on its own reservoirs and vectors. That's the reason it might not be a general public health issue or something that's threatening here in our country, in UAE. And it is just related to those who are traveling to India in high-risk places, not even all India.
Not all India. Because
Exactly.
I know the breakout has been in Kerala, hasn't it, which is south.
Yes, some parts of India, something like Kerala or this West Bengal, they are the places that more possible to have encounter with this virus. Or some other areas in the South Asia, like Bangladesh, Sri Lanka, Malaysia, Indonesia, and even Singapore. There are some cases reported there, but it is not that much too many cases.
No, but it's worth being aware of. What would be the early symptoms of the Nipah virus if you were to contract it?
Mm-hmm. It starts with fever, like all other flu symptoms might be there. Some headache, some body pains. But the most important thing, it starts progressing. And this is the hint. This is the big concern for the patient. It is important to know that if the symptoms are more than a usual viral infection, some flu thing, it's better not to make scenarios in our mind. It's better to go for a specialist, seek their help, seek their advice, and ask them to help us and help them to diagnose appropriately to protect ourselves.
So it's a fever is really the main symptom. So you could think you had the flu, or you could think you had...
At the earliest stages, yes, it looked like a flu. All of the viral infections mostly start with this flu-like syndrome. But at the later stages, they show their own specific presentations. For example, for this one, people start having some cough, some difficulty in breathing. Patients feel they are breathless. Or they might have severe headaches, decrease in consciousness level, confusion, and even seizures might happen. For us in the infectious disease field, fever plus seizures is an emergency. It means that whoever, with any cause, that feels these two symptoms together should be presented in ER as soon as possible, because for these conditions we have a golden time, and it's important to the patient to receive the appropriate care timely.
Okay, so what's the golden time? How long have they got?
Couple of hours we have, because for this Nipah virus we don't have any specific and definite treatment. For this one we have to go for symptomatic treatment, supportive care. And it is important to start the supportive care as soon as possible, because with this supportive care, we might protect our patients from progression of the infection and control the symptoms and upcoming presentations.
And Dr. Maryam, if anyone is travelling to these at-risk areas, how can they prevent themselves from getting this virus? Or are they best to just avoid those areas altogether?
This virus transmission is not related to the casual activities. It is handling by the fruit bats. So it means that the transmission happen with the contact with the bat's secretions, saliva, urine, or something like this. And most of the time, these bats contaminating the fruits and, for example, the street foods, because they're, just flying over there and spreading the secretions. So it is important in the high-risk areas, don't go for just fruit that we don't know they are completely washed off or no, or those street foods that we don't know that how they're kept and how they might be prepared. This is the best option to protect ourselves from this virus in the high-risk area.
Okay, that's really good advice. Thank you so much. That was Dr. Maryam Mojtabavi. She's an infectious disease specialist based in Sharjah at the NMC Royal Hospital.